Advanced Alzheimer's disease is a progressive brain condition that gradually impairs memory, thinking, and the ability to carry out daily tasks. In its late stages, patients often experience a severe loss of autonomy, limited communication, and a high reliance on caregivers. Medical approaches typically focus on supportive care, as regaining lost function is generally considered unlikely. The disease involves a breakdown in the brain's ability to form new connections, alongside an accumulation of specific proteins and increased brain inflammation. To explore alternative ways to manage these profound symptoms, researchers in Brazil recently documented a unique case study involving psilocybin. Psilocybin is a naturally occurring psychedelic compound found in certain mushrooms. When ingested, it binds to specific serotonin receptors in the brain. Preclinical research suggests this activation might stimulate the growth of new connections between neurons and help reduce neuroinflammation. The research team observed an 80-year-old woman with advanced Alzheimer's disease. For 5 years, she had experienced marked physical and cognitive limitations. She suffered from chronic urinary incontinence, had difficulty swallowing, could not walk independently, and showed a flat emotional affect. Her communication was severely reduced, mostly consisting of single words, and she required continuous supervision for all basic activities like dressing and eating. The researchers administered a single oral dose of 5 grams of psilocybin mushrooms. During the acute phase, the patient experienced profuse sweating and a prolonged state resembling deep sleep. Approximately 19 hours later, she spontaneously woke up and initiated an autobiographical conversation that lasted for several hours. Over the following days and weeks, the research team documented multiple functional changes. The patient regained urinary continence, a function she had lacked for 5 years. She began to walk independently and dress herself. She also showed increased emotional responsiveness, making sustained eye contact and smiling at her family members. Her memory showed signs of activity as she successfully recognized vehicles and asked contextual questions about where specific individuals had gone. These changes persisted for a month, prompting a second supervised session using a lower dose of 3 grams. During this second experience, the patient remained verbally expressive, described positive emotional imagery, displayed spontaneous humor, and showed increased walking agility. Because this was an observational case report of a single patient, it cannot prove that psilocybin will have the same effect on others. However, the researchers note that the case suggests certain brain networks might retain dormant capacities even in the late stages of neurodegeneration, providing a foundation for future clinical trials. Learn more about this study and other new research at PsyPost.org.